Hello everyone, my name is Erica Avery and I have prepared this PowerPoint presentation in regards to occupational health and safety for the office setting. Many health disparities and occupational related diseases consequently arise from detrimental working habits and inadequate exercise due to the environment of the profession. Occupational health is concerned with identification and control of the risks arising from physical, chemical, and other workplace hazards to establish and maintain a safe and healthy working environment. The focus: understanding the significance and classification of occupational health in the office setting. It is essential to recognizing a safe and healthy work environment. This hazard analysis and overview will analyze and identify all potential hazards within the office setting depicted at the University of New England. This slide here just displays some common workplace injuries in regards to the office setting. You can see in the top right corner the woman straining over her lower back, wrist injuries just below that, possibly carpal tunnel. As we'll mention later on in this presentation, some neck injuries. And just above that in the top left corner we have a comic strip depicting some possible workplace injuries in regards to tripping, falling, small confined working conditions. The background of the office. The office here is located in Portland, Maine. The office reports 60 full-time employees. Among these employees are 40% male and 60% female. The range of age is from 22 to 50 years old. The highest educational level achieved is 45% college or undergraduate and 55% graduate. The typical shift. Normal working shifts and hours vary. All employees work an 8-hour day. The employees are salaried and are not required to take breaks. A vast majority spend their day typing, typically 5 hours a day, and talking on the phone for about 1 to 2 hours a day. The nature of the job responded back predominantly sedentary for a majority of the day. A brief overview. There was no safety committee on site to recognize any threats or concerns employees may have. OSHA visits are not discussed or scheduled, ultimately eliminating the acknowledgement for adjustment and modification. Understanding the correlation between hazards and exposures are crucial. Record of incident rate. According to our data, it was reputed that the office incident rate per 200,000 hours worked is 4.7 in the state of Maine. Over the last 10 years, there have been 3 reported cases of carpal tunnel syndrome that have resulted in 5 days of lost time. Lastly, the MAUD rate at UNE, or the University of New England, was above 1, but in the last 5 years has lowered to 0.75. Although these statistics are rather low and not as alarming as the mechanic shop, we must consider the likelihood of underreported injuries. Potential hazards assessed. Observations concluded to be severe continuous and repetitive motion, wrist, neck, shoulders, back or spine, and other extremities are affected. Continuous inadequate posture or ergonomics. Observed key typing exceeds 5 hours a day with minimal to no breaks. The ergometer recorded a significant strain, which was emphasized on the amount of typing and reaching. Heights of the desks ideally were at 27 inches, which meets the minimum standard. The temperature was recorded at 25.5 centigrade. Employees noted minor dry air or breathing issues. The humidity measured 52.2% with no mold present or reported. No immediate threats or contact with chemicals are noticed or notable. Some vents create drafts or are centrally located over employees. No CO was present, and the noise levels recorded here. When the HVAC system is on, it was measured at 40 decibels. When the HVAC system is on, it was anywhere from 60 to 80 decibels, with the average noise at 75 with the system on. Effects of noise can cause decreased productivity, increased illness, increased stress, lower job satisfaction, and interference with speech. The lighting was at 480 lumens or luxes. However, a recommended stress-free measurement should be recorded from 500 to 1,000 illumination. No PPE or personal protective equipment is noted, but there is an option for gloves and extra clothing when temperatures drop below particular comfort levels for the individual or employee. This chart here just shows the most minimal to most demanding workplace injuries. At the top in green, we can see we have chemicals and PPE, which means these are rarely noticed in the workplace, so they're the most minimal to be discussed. The next one's in yellow because these do begin to affect the employee workday, the working environment, more specifically in regards to temperature, air quality, noise levels, lighting, and more specifically the stand and sit options at workstations. And then in the red, we have what's called the sedentary and repetitive motion category. This is more specifically for musculoskeletal injuries, including sprains and strains, which are the most significantly reported. The 8-hour predominantly sedentary shifts, which include sitting, the 5 hours of typing and keying, 1 to 2 hours on the phone, and repetitive muscle movement using the same extremities. This is a workstation suggested guide for the office setting. You can see how the workspace should be set up appropriately with the proper ergonomics and working conditions to prevent injuries. Modifications and implementation for improvement in injury prevention. An on-site safety committee will be implemented, required and mandated scheduled OSHA visits, quarterly surveys given to each employee to assess working conditions for overall health and well-being. Lighting in the office will be effectively remodeled and replaced, meeting the 500 to 1,000 lumen recommended standards. Temperature, humidity, and HVAC systems will be frequently monitored and serviced appropriately to assure air quality is immaculate. MSDS reports mandating and read periodically by all employees to educate and utilize their options. PPE will be readily available in several different options. There will be a mandatory expansion on the office space, and more specifically, the individual cubicle sizes will be enlarged. On-site health facilities will be provided to all employees. This here is just a helpful reminder that depicts some office syndromes and symptoms and allows some stretching exercises to prevent injury and strain. This concludes the hazard analysis, so thank you for your attention and participation in regards to this matter.